Pathophysiology of Hodgkin lymphoma. B cells in dark zone of germinal center undergo multiple somatic mutations, and then some go to light zone, others undergo apoptosis. Failure of apoptosis causes Hodgkin. Which gene mutation causes this defect in apoptosis? PDL1 gene aberration on 9th chromosome. Age of presentation of Hodgkin lymphoma. Bimodal 15 to 34 in greater than. Lymphoid tissue involvement in Hodgkin and non-Hodgkin lymphoma. In Hodgkin, nodal involvement. In NHL, extranodal. CNS involvement in Hodgkin and non-Hodgkin lymphoma. In HL, paraneoplastic cerebellar degeneration seen. In NHL, not seen except Burkitt. B symptoms involvement in Hodgkin and non-Hodgkin lymphoma. Seen in HL, rare in NHL. Contiguous lymph node involvement in Hodgkin and non-Hodgkin lymphoma. Present in HL, absent in NHL. EBV involvement in Hodgkin and non-Hodgkin lymphoma. More in HL. Fever pattern in Hodgkin lymphoma. Pell-Epstein fever, low-grade irregular fever, spikes gradually, then a febrile period, then again low-grade. Cycle continues. Special cells seen in Hodgkin lymphoma. Reed-Sternberg cells, bilobed nucleus, eosinophilic nucleoli, separated by clear space from nuclear membrane. It's specific for HL only if inflammatory background present, cause HL is most inflamed human tumor. Types classification of HL. 1. Nodular lymphocyte predominant HL. 2. Classical HL has subtypes. Subtypes of classical LR lymphocyte rich, LD lymphocyte depleted, NS nodular sclerosis, MC, mixed cellularity. Which type of HL is MC worldwide and in India? Worldwide, NS, India, MC. Immunotyping for nodular and classical HL. Nodular, CD20, 45. Classical CD15, 30. B symptoms for nodular and classical HL. Absent in nodular, present in classical. EBV involvement for nodular and classical HL. EBV involvement absent for nodular. 170ths 40/20ths rule for classical. What's 170ths 40/20ths rule for classical HL, EBV involvement? EBV positive cases in LD -100%, MC -70%, NS -40%, LR -20%. Histology for nodular and classical HL. Nodular, popcorn RS cell. Classical, LDRS cell absent. MC classical RS cell. NS lacunar RS cell. LR paucity of RS. Clinical features of Hodgkin lymphoma. 1. Diffuse painless rubbery firm lymphadenopathy. 2. B symptoms. 3. Alcohol-induced increased size of node. 4. Unexplained pruritus. 5. Pell-Epstein fever diagnostic. 6. Paraneoplastic manifestation. Site for lymphadenopathy in Hodgkin lymphoma. Post. Cervical greater than supraclavicular greater than axillary. Paraneoplastic manifestation seen in Hodgkin. 1. Subacute cerebellar degeneration. 2. Minimal change disease. 3. Cholangitis. 4. Vanishing bile duct syndrome. Other, hypercalcemia, hypoglycemia, hyponatremia, high LDH. SVC obstruction in young female of Hodgkin lymphoma is seen in which sub. Nodular sclerosis due to involvement of mediastinal nodes. Which is single most valuable test for staging in Hodgkin's? PET scan. PET scan in Hodgkin lymphoma uses FDG fluorodeoxyglucose. Unfavorable signs while staging of Hodgkin disease. Age greater than 60. B symptoms. Bulky nodes greater than 10 cm. Greater than 4 extranodal sites. ESR greater than 50 mm per hour. Beta-2 microglobulin indicate poor prognosis in Chia, HL, MM. Which HL subtypes has what kind of response to chemo? MC, LD, poor. NS very good, LR excellent. Treatment of Hodgkin lymphoma. ABVD regimen. Adriamycin, bleomycin, vinblastine, dacarbazine. Side effects of treatment to Hodgkin, medication. Adriamycin cardiotoxic, bleomycin lung fibrosis, vinblastine ferrifer L neuropathy, dacarbazine. What scale is used to determine score of PET scan in Hodgkin's? Deauville 5-point scale. Anti-CD30 drug used in HL, name and indications. Brentuximab, in refractory and advanced HL. What regimen is followed for advanced HL? BEACOPP regimen.